Hi guys. Today we'll be talking a little bit about gum disease and how it may be relevant to your health. Some of you may have heard someone talk about or experience yourself bleeding gums, moving teeth, teeth which appear longer than others, or even sensitivity to hot, cold, sweet, or sour food stuff. If you've experienced any of these, chances are you might have experienced gum disease at some point of time. So the issue with gum disease is that it remains largely painless over its course, and by the time you're concerned about why some of our teeth are moving where they are, uh, it's already too late. So by too late, I mean that the disease has already advanced to a point where it is probably not possible to reverse things back to where they were. So a patient of advanced forms of gum disease essentially remains a patient for life. You can stop it where it is, but you can hardly reverse the damage that's already been done. Um, to put it further into perspective, the economic burden of gum disease alone in the United States was pegged at roughly 3.5 billion US dollars, while indirect costs to the economy were a whopping 154 billion USD. So, what do we do about this nefarious disease that we're talking about? So generally, the management of gum disease takes multiple visits to your dentist, and it may involve specialists as well as depending on how severe a case we're dealing with. So eventually, if some of your teeth fall out or they need to be removed, you would have to get some form of dentures or implants. These accrue further costs, visits, not to mention the surgical procedures which go along with, implant placement procedures and stuff like that. So, and don't for a second think that gum disease would only affect your mouth or like one corner of the mouth where it is manifesting at the moment, and the rest of your body can just go on functioning the way it is, and that as if nothing's going on. There is sufficient basis to establish an association between gum disease and other illnesses, such as those which affect your heart and blood vessels, diabetes, Alzheimer's disease, just to name a few. So, as it turns out, taking care of your mouth might actually end up helping you with managing other potential problems in your body. So, even though a larger portion of the population tend to suffer from some form of disease with advancing age, this is not an inevitable occurrence. So, if you're diligent about oral care by brushing your teeth regularly with a toothpaste, flossing, and using other oral hygiene aids, such as mouthwashes if required, along with keeping up with regular visits to your dentist, you'll find that you can nip most of these problems in the bud. But then what happens if you already have gum disease? So, in fact, even if you do have gum disease, you can still have a healthy mouth if you follow your dentist's advice and receive proper management in a timely manner. So, it's important to keep up with these things as and when they develop and not to ignore them particularly. So, though gum disease can't be completely reversed, it can still be stopped in its tracks by proper management, giving you a healthy mouth and better overall health. So, it's something to think about. Thanks.